So if you're that person who has just missed her period, or if you're that person who is trying to conceive and you haven't seen your period yet, but you know that you've been having unprotected sex for quite some time now, then this video is definitely for you. What's up, guys? Welcome to Let's Learn with Nurse Grace. If you're new to this channel, my name is Grace Ezekiah. I'm a registered nurse. So if you're always been here to support me, thank you so much. I don't take it for granted. Thank you. So if you haven't subscribed, please make sure that you subscribe to this channel. So as you can see from the title, I'll be teaching you on how to do a home pregnancy test. So I've been having people ask me how to do a pregnancy test, when to do it, and why it should be done at this time and this time. So this video is specifically for you who has been asking. So I'm going to be teaching you on how to do a home test, and I will just be telling you on how to do it. So if you're the one who is interested in this video, please make sure that you watch this video until the end. So I'll just be talking you through on what happens before you get pregnant. So definitely before you get pregnant, then a man and a woman have to meet. So when they meet, the man will ejaculate the semen, which has got sperms in the vagina. So when it deposits in the vagina, then it's going to go through to the cervix. And when is that time when a woman has just ovulated? When it finds the egg there, then there's a high possibility that it's going to be fertilized. So once it has been fertilized, then there's a process known as implantation. This fertilized egg, it has to be implanted into the uterus so that it can get oxygen and other nutrients from the mom's side, and so that the placenta can form and everything. Implantation usually happens anywhere between 6 to 12 days post ovulation. So once it has happened, then after a few days is when you can start testing for your pregnancy test. And what exactly do we test in this pregnancy test? So pregnancy test can be of urine and can be of blood. So it depends on what exactly and where exactly are you. So what exactly is tested in? So what it's tested in is called as HCG, human chorionic gonadotrophic hormone. It's just such as a chemical. So that is the thing that is being tested. So when you see that your pregnancy test is positive, then it means that there's a high possibility that you might be pregnant. In the subsequent videos, I'm going to be telling you on why you can find your pregnancy test, and after a few weeks or so, you can find that you are definitely not pregnant. Then there's a high possibility that can happen. So today I'll just be teaching you on how to do it, but in my subsequent videos I'll be telling you on why. So if you are very interested to know about that, please make sure that you subscribe and put on the notification button so that you don't miss on any exciting videos that I'll be releasing. HCG is what is normally tested on the urine or blood. So when it tests positive, it means that you are pregnant. When it's negative, it means that there's a high possibility that maybe you ovulated late and your implantation happened late, and therefore your HCG is not the right amount for you to start testing, or there's a high possibility that you are not pregnant. So that is what happens. So people have been asking, what is the earliest I can start testing? So the earliest you can start testing is 8 days post ovulation. So if you're 8 days post ovulation, then you can start testing your urine for you to see if you're pregnant. And this happens because there are those people who ovulate a bit earlier. So if you ovulated a bit earlier and immediately the sperm got it and it fertilized and implantation happened, then there's a high chance that you might find it positive. And if it happened late, then there's a high chance that you might find it negative. Or if you're not pregnant, then you might definitely find it negative. So people have also been asking me on what is the best time for you to do a pregnancy test. So the best time for you to do a pregnancy test, I would say early in the morning. Why is it early in the morning? During the morning hours or during the nighttime, towards the morning is when the HCG is most produced in our bodies. And also at that time, it means that you have been sleeping the whole night. When you have been sleeping, you haven't been drinking much during the night. And there's a high possibility that the urine has been staying in your bladder for up to more than 6 hours. Then there's a high possibility that your urine is going to be concentrated of the HCG. And if you test, then there's a high possibility that it may turn positive. So another thing, you can also do either any day, any time of the day. If you don't get to do during the morning, of which is the best time. If you don't get to do during the morning time, you can do any other time of the day. But I would also advise you is that to let urine stay in your bladder for up to 3 hours if you can be able to hold it. But if not, please just go and release yourself. Don't stay there saying that Nurse Grace told me to stay 3 hours for me to test positive. Don't do that, please. If you can't hold it, please just go to the toilet and release yourself. If you're able to hold it for up to 3 hours, then please hold it and avoid taking too much water before that, because if you do that, then it's going to be concentrated, to be diluted, and if it's diluted, then there's a high possibility that you won't get the results that you want. So let it stay in the bladder for up to 3 hours. If it does that, then there's high chance that it's going to produce the results that you want. So now we go to the testing part. So how do we test it? So guys, disclaimer, this is not urine, this is just juice in the color of urine. I'm not going to be using any urine in this process. So this is not urine. People think that it's urine. It's not urine. So it's just some juice that I'm going to be using. So we don't expect the results to be positive, definitely. What happens? So the first thing that you've got to buy a pregnancy test. So there are varieties of pregnancy tests. So I'll just be using this clear blue because it's what I found available. So I'll be using this. So there are different types of pregnancy strips that you can use depending on your pockets. There are those that are cheaper, there are those that are expensive. There are those strips that tell you can see as early as how many days, and there are those like this one, it says results 5 days early. It says the results 5 days earlier, so earlier before your period. So it depends on what you're looking for. And also this, you can see it's also pregnancy test with weeks indicator. This also shows that the amount of weeks that you're going to be showing. So it can either be pregnant 1 to 2 weeks, pregnant 2 to 3 weeks. So it normally tests depending on the amount of HCG that is in your body. So you can use any strip that you found. And before you use your strip, so this was in a box, but even if it's in a box, it normally comes in another sachet inside. So you can see this one. I already removed the sachet. It doesn't come like this. It comes in another packet, and the other packet, it has got some what is it called? It has got something that prevents moisture from getting into the strip. When you buy your packet, make sure that it's not broken, because once hair goes into the strip, then you're not going to get the results that you want, because the strip already absorbs a lot of water, and if it does, then you're not going to get the results that you get is going to be invalid. So make sure that you try to see that there's no air inside the packet. Make sure you check on the expiry date. Make sure that the expiry date is not past. Like this one, you see it's 2025 January. So make sure that you check the expiry, check when it was manufactured. Maybe it hasn't stayed in the store for too long. Just make sure that you check a lot of things before you go ahead and start testing. And before you actually start testing, it usually comes depending on the package. So there are those packages that comes with the instructions on top of the box, on top of the paper, and there are those packets that come with the instruction inside. There's a leaflet inside. So for this, I don't have any leaflet, but it came with a leaflet inside. So there are those that comes with a leaflet. It's better for you to read the instruction, know how many minutes you're supposed to leave it settled for before you look at whatever the result is. Let it tell you how many minutes you're supposed to be dipping inside the urine before you put it in the tissue or whatever. Read the instruction very well and know what exactly. It will tell you on how to do it exactly depending on the strip that you have. So as for this, it just tells me to just dip for a few up to 10 seconds. I remove it, then I drop it in my tissue paper. So when I drop it, then I'll just leave it for up to about 5 minutes, then I will check my results. So that is according to this strip. But I've told you it comes in different strips and different instructions. Please make sure when you buy yours, please read on the instruction that you've been given. And when they tell you it's 5 minutes, please make sure you leave it there and put your timing up to 5 minutes. Leave it for 5 minutes before you check. So that is what I'm going to do. So once I've already read my instruction, once you've read my instruction, go collect your urine and make sure that the pot that you're collecting your urine in is very clean so that you don't contaminate it with various things. If you've got maybe a bottle or something, please make sure that you wash it very well with soap and water before you go and pee. And when you pee, make sure that you collect the middle pee. Let the first pee go through, then put put your container down there, collect your middle P, and you can test using your middle P. This is just to prevent maybe you from finding maybe a lot of dirt, maybe tissues that were there and everything, and make sure that your bottle is very clean before you collect your urine. So I've already collected my urine, is there. So what happens, I'll just open my test strip. Once I open my test strip, I'll just be dipping it for a few seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll remove it, let it drip a little bit, then I'll lay it down on the paper. So I'll let it to lay down for about 5 minutes. So when the 5 minutes is done, so after 5 minutes, I'll be looking at my test strip and see how the results are. So if for me, I told you that I'm not using any P, so I'll not be getting anything. Definitely I'll get not pregnant, but this strip doesn't show it. If it's pregnant, then it's going to be reading here pregnant. And if it's not pregnant, then it's going to be reading here not pregnant. But depending on the strip, that there are those people who use the small strips, then it comes with the lines. It can tell you, it can show you on what to look for. Like this one will tell you if you're pregnant or not. And there are those things that tells you if it's 2 strips, there are 2 strips there, and then it means you're pregnant. If it's 1, it means you're not pregnant. So just depending on the instruction according to your strip. So mine will tell me not pregnant or pregnant. So that's how you do your pregnancy test. So if you do it and you find that you're pregnant, congratulations, mama. Welcome to my channel where I'll be teaching you on everything about what you need to eat, everything about your pregnancy. I'll be teaching you about that. If you're not pregnant and you're also trying to conceive, I'll be telling you on what are the factors that you need to be doing, something that you need to be eating, the type of medication, type of vitamins that you need to be taking in order for you to increase your chances for you to conceive. And from my past videos, I've also taught you about the best days for you to actually try conceiving. So that's how you can do your pregnancy test. And if it's positive, I'll advise you to go to your gynecologist or go to your doctor as early as possible, so that in order for them, usually they're going to be doing another pregnancy test in order for them to just be sure that you're pregnant. And if they also find that it's pregnant, then they're going to be starting you on very, very important medications, of which I'll be talking about in my subsequent videos. These medications, they're very, very, very vital, and they're very important for you to start in your early days of your pregnancy. If you're pregnant, then the doctor will guide you through and will tell you what visits you're supposed to be coming in and what types of injection you're supposed to be getting. So they'll guide you through everything. So that's how we do our pregnancy test. If you've got any questions, please make sure that you leave in the comment section. Please make sure that you subscribe to this channel so that we can get to learn more of this. Thank you so much for watching this video. Please make sure that you subscribe. I'll tell you a million times, please make sure that you subscribe. See you on my next video. Goodbye.